The country is caught between the difficulty of what needs to be done to slow the spread of COVID-19 and what its majority must do to survive on a daily basis as the coronavirus delivers a crushing blow on the economy. So will it be eat or to heal? Well, NTV's Silas Apollo did seek the opinion of a public health expert who walks us through this important decision. In the view of this epidemiologist, easing restrictions should be done cautiously if the gains made in containing the virus are to be sustained. And of course, this is something as well that the president has continued to speak about in terms of trying to open up the economy in the country. But of course, mentioning that it will be taking quite a hit. Let's take a look at that report by Silas.
With the country's resource tanks running on empty, the country is mulling over gradually filling her way out of the limits on daily life imposed to curb the spread of the virus. But epidemiologist Uhuru, however, says that such President Kenyatta's pronouncement hinting at a possibility of reopening the country should not be celebrated just yet, as easing restrictions could prove challenging, especially for a country like Kenya, which is stuck between protecting lives and allowing its citizens to eke out a living.
This is a new virus, and meaning that all people are susceptible, and therefore it sweeps very fast across the population, affecting people. Our worry will be if the people requiring hospitalization are too many or beyond what the health system can manage. The silver lining a little bit about the virus and the disease that by far the majority don't require hospitalization.
Uhuru says that one of the methods the government could employ is the hammer and dance technique, where the reopening is based on how manageable the infections are.
The hammer meaning the restrictions, when we apply the movement restrictions, people's closing down businesses and only leaving the essential services. But then the dance phase is when you are applying mitigation measures, opening up some of the businesses, but urging people to take measures, including social distancing, including use of masks.
Kenya, just like other developing countries in Africa, has been singled out for its fragile healthcare system, as well as the high poverty level among its citizens. Any attempts to reopen the country, therefore, has been cited as a recipe for disaster, even as the government struggles to find a balance between providing for its citizens while also protecting lives. Some of the world's most advanced economies in Europe and even in China have in the recent past experienced a spike in new cases after governments eased lockdown measures. President Kenyatta on Saturday said his administration was aware of the strain that the virus had put on the economy and that easing up of restrictions will depend on how Kenyans behave. Guidelines by the World Health Organization on managing the spread of the virus in instances where a country decides to reopen schools, businesses or public spaces advocates for an adherence to social distancing rules, use of face masks in public, as well as maintaining the highest level of hygiene possible. WHO further calls for an increase in mass testing, which it says is important in monitoring and managing the spread of the virus among the populace.
We need to ensure that as a government, the testing is enhanced, is ramped up, and all people who require to get the test get tested, and those who become positive then get isolated.
Silas Apollo, NTV.
All right, thanks, Silas. Well, the president's plans to slowly ease the cessation of movement and curfew directive in a move to start building up the economy has elicited different reactions. Here's what some of you had to say about that.
If it is increasing every day in terms of almost hundreds, then how do you expect when everything is now opened up, it will be in thousands and this country will be in chaos?
The Kenyans will be risking their lives because they are not obedient at all. Ukiwaambia keep distance, hakuna mwenye anafuatia hiyo sheria.
The government to procure test kits and supply to all counties so that every county will be in a position now to test this coronavirus.
Watoto pia shule zifunguliwe. Kama tunasema watoto, kuna watoto wanasoma Mombasa, wanakuja Western, wanakuja Kericho. Basi kama atabadilisha watoto wasome Wa Mombasa wakwe Mombasa, wabadilishwe kwa mashule ya Mombasa, ni sawa.
Sisi ni watu wale wa chini kabisa, kutoka kwa mkono ni kukula. Sasa tumeumia sana. Akifungulia tutafurahia ili turudi kasi.
Lockdown naona iendelee njoo. Sasa tukiendelea na ngojwa eti ndio biashara ikuwe mzuri. Na bado kuna hii ugonjwa inaendelea tu. Hakuna anja. Hii ugonjwa ni kama zamani ukimwi. Hii ugonjwa haishi. Lakini tukipatiana ile social distance, mambo itakuwa sawa. Na tukivaa ile mask tunaambiwa na serikali, mambo itakuwa sawa.